Professor Jeffrey Sachs, thank you very much to begin with for joining us on 3450.com.
Well, it's a pleasure.
I'd like to begin by talking about the sort of work that you're doing with others. You're tackling big issues around the world, such as poverty and ending poverty, malaria, tuberculosis, and those sort of huge killers. How do we, as an organisation at the Oxford Health Alliance, begin to address the other big issues that don't get the airtime?
People already know a lot about poverty. They know a lot about climate change. They know a lot about other terrible burdens. Now you're going to come and tell them about heart disease, adult onset diabetes, obesity, terrible things they're eating. Oh my God. Well, they will turn out unless you're also telling them, hey, wait a minute, just listen for a moment. There are some real solutions to these problems, not just horrible things. So I think the key in all of the communication, in my view, is the public is interested. Don't presume they're not. The public wants to hear sound science. They don't want to hear just random views. They want to hear some really sound ideas. But most important of all, they don't want to just hear about problems. They want to hear about answers. Now, also helping to put some of those practical solutions into operation in at least some places. Because when you have success stories to tell, that's when it can spread dramatically. So to move from words to action is to move from the problem to the solutions, from the solutions to the demonstrations, from the demonstrations to the uptake and diffusion worldwide.
I mean, ironically, the more successful you become at ending poverty, you may begin to influence people's lifestyles. How do you solve one without affecting the other?
A lot of the non-communicable disease burden increase is a matter of change of lifestyle. No one's guilty. It's just a change from heavy physical exertion with a low-fat diet to urbanization, more sedentary lifestyle, and a kind of fast food diet. And now, since that has come upon world society, including very poor countries indeed. So these changes do have consequences. Generally, these are unanticipated consequences. So I have no illusion about this. Life isn't one battle, and solving these problems is not one battle.
You used the term analytical deliberation, this idea where you bring a lot of disparate people together under one roof or under one strategy to make something happen. How do you achieve that coming together of people who, as you already said, don't necessarily meet each other all that much and probably don't even trust each other?
I've often believed that getting disparate groups together, especially if you can get the apex leaders of these various stakeholders, so-called, together, that can make a big difference. There's a lot of misunderstanding in general in the world. There's a lot of mistrust. And if you take any issue like fast foods, trans fats, implications for diet, well, you can easily have the food industry, the NGO community at each other's throats, basically, making wild accusations, and I'm not going to sit down with this person, I'm not going to sit down with that person. In general, that doesn't lead anywhere. Of course, I also believe you don't please everyone all the time. You speak the truth as the best science and the best evidence suggests it, but not to go after and vilify anybody, but rather to try to bring different groups together and say, here are the facts. You don't believe the facts? Bring your interpretation, we'll debate them. Once we've cleared the underbrush of you say this, generally, if you got people locked in a room metaphorically, that is in a process where they can't so easily walk away, you can really narrow the differences on the fact base. Then you can start talking about what are some practical approaches to this.
This reminds me of a term I think I read that you wrote called enlightened globalization. I mean, I'd like you to explain what you mean by that term and how that might help us confront the epidemic of chronic disease.
Companies more often than not are the holders of technology. They develop technologies that are life-saving. Now, the rules of the game are often flawed. If you have patent protection for life-saving medicines that don't reach the poor, that's no good. I don't blame the companies for that. I think we have to work through a tricky problem. How do you give incentives for R&D and at the same time make sure that the poor are not cut out? So I believed in enlightened globalization, which is let's think through practical problems. Let's not beat each other over the head. You're to blame. But rather, let's say we got a real problem here. Here's the evidence. Don't walk away from the evidence. You can't leave this room without helping to brainstorm in this solution. That's the analytic deliberation. And I always speak of the room figuratively. You know, it's not locking people in place. It's saying, let's get part of a process to work on these hard issues. If you allow all of those factors and you're very creative about it, I do believe globalization can be made to work for everybody. And I think that that's the goal. The key to our prosperity is not exploitation. The key to our prosperity is good technology, good modern management, wonderful information systems, communications technology. That's why the rich world's rich, that really it's developed some extremely powerful tools. And that's why we shouldn't be so afraid of looking honestly at solutions for the poor, or honestly at solutions for people who will die of cardiovascular disease because they're eating the wrong things. We don't have to be afraid of that stuff because we're really rich enough with great tools to be able to solve those problems. And if we just turn the decibel levels down, we do identify people that are so greedy that they won't participate in honest discussion. And then we get the broad circle around those who are part of the industry, part of the NGOs, part of the public, part of government, that do want to have an honest discussion. Then we'll find practical solutions.
You also said that I believe the single most important reason why prosperity spread and continues to spread is the transmission of technologies and the ideas underlying them. How important do you think the role of the internet, for example, will be going forward?
I think the internet may be as important, maybe even more important than the cell phone. It's just extraordinary because now when I go to the most isolated places in the world, cell phones are working. And often, now this is added expense, someone's put up a dish, and if there's no fiber on the ground, at least there's satellite broadband. That changes everything. People get information, and the things that we're going to be able to do with broadband are phenomenal. I don't think we've really even scratched the surface, especially in the area that I'm engaged in, which is very, very poor people. Of course, very poor people, as long as there's the satellite dish there and the computer, and that's a big if still, unfortunately. But if it's there, the whole world's knowledge systems are online and available to people. The weather forecast, the transport options for farmers, the prices in different sectors, new forms of job creation, distance learning, telemedicine, downloading information, sending emails. You know, it is incredible, actually. So in my view, this is absolutely, truly revolutionary. It's a big deal. And I see the change first coming with the cell phone even more than the computer, because that is spreading everywhere, even in very poor places. You see the cell phone flipped on in rural Africa now. Not ubiquitous, but enough to make a big difference so that there's connectivity. And connectivity is information, and information is empowering, and it's going to bring solutions.
Is there a way we can help each other? Is there a way we can help you help us?
When I got into some of the public health leadership issues, as chairing a commission for WHO, for example, in the beginning of this decade, we put the emphasis on the infectious diseases and on undernutrition, on micro and macronutrient deficiencies, and on unsafe childbirth, both for the baby and for the mother. And noted that that accounted for a huge proportion of the health gap between the rich and the poor. But that's not the end of the story, because there's a great deal of disease burden that isn't in that small group of conditions that cause the gap, but rather it's a heavy disease burden both for the poor and for the rich. Poor people die of heart disease like rich people do. Poor people die now increasingly of diabetes, especially adult onset diabetes, like rich people do. So even though many of the chronic diseases aren't part of the gap of health between the rich and poor, They're part of the disease burden of rich and poor, a major part. The key is to address those as well, recognizing something that is not widely recognized. Implicitly, many people in development have thought in the past that to address the chronic diseases is also beyond the budget of poor countries, that this is so expensive. Let's do the immunizations and address the bed nets and the malaria control, but there's nothing one can do low cost for heart disease. There's nothing that one can do low cost for diabetes and so forth. That's not true. We now understand more and more that just as there are very practical, preventative, and curative approaches for the infectious diseases, there are very practical, low cost, even negative cost in a way because some of the behaviors would free up money to address the chronic diseases. So the fact of the matter is we're beginning to understand by looking more deeply at these chronic diseases that it is not open heart surgery that one's talking about. One's talking about a lot of public health measures, a lot of prevention, a lot of helping people to understand how to have healthier behavior, whether it's more active lifestyles, whether it's not smoking, whether it's not having trans fats. A lot of it could be actually with the food industry saying, no more trans fats. This is a killer. Find other ways to get the fatty acids in there, but not the trans fats, which are so distinctively dangerous. So I think the point is that the development agenda and the chronic disease agenda are not at odds with each other. This isn't a competition. But now we have to broaden the agenda because we've understood that not only are there massive problems of chronic disease, there are low-cost solutions fully applicable in low-income settings. So this is not the fight of the heart transplant unit versus the immunization, the way it's often portrayed. This is something good for the poor and good for the rich. And the fact of the matter is the basic message of the Commission on Macroeconomics and Health, which I chaired for WHO 6 years ago, was that health is good for development. So don't think of health as a cost center. Think of it as a profit center. It's something that's going to add to economic development.
You talk about money, and in the process of what you've been doing, you've got a lot of philanthropic money coming in. Is there money there extra money there for chronic diseases, or is that sort of dried up and we should be looking somewhere else?
The key to raising funds is that it's pointed towards real solutions. And the solutions, everyone wants to know, A, are they scientifically sound? B, are they effective? Do the interventions really work? No sense in spending a lot of money on something, even if it's scientifically sound, if people won't abide by the protocols or whatever. So is it effective? C, is it cost effective? You know, is this really the best way to do it? People do not like to give away their money. This, I have to say, is something that is probably understandable, but is really true. So you have to make the argument, this really works, it's important, and it's the cheapest way I could think of that is really going to solve the problem. And in that sense, it's not so much a question of the broad category aid or the broad category of raising money. It really falls under the specific solution category and what do you need to implement the specific solution.
Bono, in the foreword to your book, The End of Poverty, described you as being angry. How much do we need anger or moral outrage to get these issues driven onto the global stage?
I get angry at times, but I think more than anger actually is stamina and some guts to be telling what you know, doing the hard work to be right, because frankly, if you don't have the science behind you, you can get battered in this stuff. And so being accurate is crucial. Having stamina is absolutely crucial. Maybe the anger keeps the stamina. Sometimes the anger isn't so helpful. But I do think keeping the edge that this counts. I mean, after all, how could it not count when we're talking about hundreds of millions of people with diseases that can cripple or kill them? It counts a lot. And so that's what should keep us going, that this is real, it's big time, and it's solvable.
There's a lot of people believe that you can't change these huge issues as an individual. What is your view of that?
I think it's ridiculous, obviously. I think we all can do an incredible amount. And again, I think that something like the Oxford Health Alliance can play a huge role. It creates a base, a platform for reaching out to the world. Now, if the issue's not a good issue, you know, you're defending some crazy proposition that makes no sense, then unfortunately, actually, that can go on for a while, but it can't go on for the long term. Whereas if you've got a great issue, like the risks of pandemic disease, which can be prevented or solved at low cost by being clever about it, it's irresistible. And so people that get involved in that are going to make a huge difference. It is a sense, though, of, I believe, a worldwide social movement right now. Let's get our planet a little bit under control. I do really think we're facing a big choice. Somehow we're on this war jag globally, so we're spending all our time on the war on terror at the political level. This, to me, is crazy. It's completely ineffective. We've gone at things the wrong way. The military are not going to solve these problems. They're also not going to save people from cardiovascular disease, and they're not going to save children from malaria. And the military approaches don't work for the sustainable development challenges. And most of the unstable places in the world are unstable because they're facing real burdens of poverty, instability, disease, and so forth, hunger, water stress, and so on. So what's really needed right now is a kind of massive social action, in my view, that says, let's get on the peaceful path. Let's think, be science-based. Let's understand this clash of civilizations is another myth of our time, because frankly, whether you're Christian or a Muslim or anyone else, you can still get adult onset diabetes, you can still suffer from malaria, you can still have cardiovascular disease, you can still be in a water-stressed community. These are common issues for everybody. They do not depend on the cultural divide. They are uniting issues of us all together versus common problems. So my view is we're really in a worldwide movement, and I want this worldwide movement to take away politics from the war approach and put it on the peaceful development approach, and that means health, it means environmental sustainability, it means getting to the things that really matter for the quality of life of people.